So CPAP stands for Continuous Positive Airway Pressure. Essentially, it's a device that gets used for patients who have obstructive sleep apnea or other forms of sleep-disordered breathing. The whole point of CPAP, of course, is to provide pressure support to open up the airway to treat obstructive sleep apnea, which is, of course, the collapse of the upper airway. So that, in turn, helps patients sleep a lot better.
Oh yeah, so this is a CPAP mask. This is what goes in the patient's face.
With using CPAP, we're trying to stabilize and help the patient control or have more stable breathing when they are sleeping.
The machine will output pressure and it gets delivered through this tube, so that pressure will help to split open the upper airway. Then they'll eliminate any sort of snoring, any sleep apnea, and hence eliminate any daytime symptoms.
Most important variable we're looking at is called the AHI, it's the apnea-hypopnea index. It's a measure of how many times per hour on average that you may be having complete or partial closures of the upper airway. Anything above 5 technically is pathological. It's classified as varying severities of sleep apnea. So what we're trying to do is bring that AHI number down to below 5. That's what's considered the normal limit. It should reduce breaking sleep, taking sleep from a deeper stage of sleep into a lighter stage of sleep, or perhaps even into wakefulness.
Okay, so this here is the device which we use for level 3 sleep studies or respiratory-based sleep studies. So when the patient comes in, we show them how to put the device on. So pulls the physician strip, moves in the center of the chest to pull, that comes to. So this will measure your breathing, respiratory effort, position. This will measure your oximetry. So this is nasal airflow, so it's measuring flow, so we know if sleep apnea there's the reduced flow or there's absence of flow. Little microphone at the top, so it detects your snoring. That there's an oximeter, so it measures your oxygen level and heart rate. Mine's nice and high at the moment.
Yeah, I think a lot of patients think that doing a sleep study is a huge, uncomfortable thing with heaps of wires going all over the body. And while that is true, that's only one of the levels of sleep study that we do.
One of the devices that we use for a home sleep test. So the device has 2 parts. The bottom bit there is called the cradle, and the cradle charges the ring, and the ring is what's worn to perform the sleep test. All you need to do is, just before you go to sleep, put this onto your non-dominant index finger, like so. It's pretty comfortable, just like a ring. So that's worn for the whole of the night. So this will measure a few things, measures heart rate, oxygen level, can help with sleep staging.
So I think there's a big misconception about potential discomfort of doing a sleep test, but it's a pretty seamless, comfortable experience as well.